Fantastic. So my question was very much around how the crime harm index reflects the changes in crimes that have come forward during the pandemic, and particularly with regards to cases around domestic abuse, where the risk of harm has increased, and how that might be applied not just to the existing crime harm index, but to global policing and other forms of indexes that are being applied.
Well, one of our members of this panel is a member of the Scientific Advisory Group to Government for Emergencies, or SAGE. I won't tell you who that is, but I'll ask Peter Neighborhood to answer your question.
So this is an absolutely fascinating question. So there's several elements to it which for which the crime harm index provides something we haven't had up to now. So first off, there has been this year, as it should be fairly obvious, even in the immortal words of the Home Secretary, who said that shoplifting is down. Well, if you close the shops, it will be. But there have been some dramatic changes. Our colleague, Professor Manuel Eisner, has been doing a global survey in about 20 different countries, looking at the changes. It's not actually, you talked about the kind of assumption that domestic abuse is up. It's not quite as straightforward as that. It's a somewhat more complicated picture than might seem. I mean, for obvious reasons, a lot of the street crimes of like robbery and a lot of sort of thefts in public spaces have gone down in many countries, including the UK. But they've also bounced back pretty rapidly as things have opened back up again, and Manuel's about to publish that data, so you'll be able to see that in the public domain. What has also happened is there have been a range of what I would describe as new crimes, and they're not new crimes in the sense that they were still a category, but they were new crimes in terms of the scale and shifting focus of different types of victim. Notably, there have been a really significant number of countries where in the second wave there have been quite significant and aggravated assaults on staff at hospitals and attacks on hospitals and medical facilities. And my guess is, as the vaccination process rolls out, that may occur in quite a number of countries in a pretty unpleasant way as people get desperate for the vaccine. So that's going to require. That's been one of the things that we've been concerned about on SAGE. So, but CHR is capable of being adapted to deal with that. For new offences, we can simply use the same mechanism that we use now. We take the standard final penalty at the bottom end of the process, the starting point, and we apply it. So we can look at whether there's been a significant additional harm as a result of breaches or restrictions, and we can compare different jurisdictions to some extent on that as well. I mean, over 1 million tickets issued in Paris alone, and considerably less than that in the whole of the UK, suggests a very different perception of the approach to enforcement. On domestic abuse, we've got a very well constructed set of, as Matt has replied, we've got a very well constructed set of guidance in the CHI on the starting points for those, and including we've just adjusted that for the one for coercive control after we realised that it wasn't reflecting the seriousness that Parliament had put in place, even though the sentencing guidelines were still trying to catch up. So it's there, and we can use CHR to pattern these things.
Thank you, Peter. Lou,